First of all, it's been 20 years since, or 21 years actually, since I've had an affiliation, attended an event with the BC Council for the Families. 21 years ago, before I was a parent, I was asked to come along and help judge a competition that the council had at that time for the Family of the Year. And so here I am 21 years later. At that point in time, my partner was pregnant. In that 21 years, well, I've learned a lot more about fathering than I knew the last time I was here. I've been through lots of sleepless nights. As Lucas was doing his very entertaining show, sort of like there was almost a video camera in my mind reeling through all those fights about whether it's food or discipline or get into the car or don't get into the car or go to sleep, shut up, do your homework, learn to play violin. No, you can't do that. No, you're not going out to the Barnhartville pits on Friday night with 200 other kids because everybody is there, and etc. and so on. All of those things that are part of the wonderful challenges of parenthood. I guess just so you know, the second part of my career I've been in the university, teaching, researching, doing some service work. The earlier part, the very beginning, I started as a youth worker with the Y in New Westminster. I actually finished high school at Burnaby North, grew up in Vancouver, worked for the Y in New Westminster, worked for Cedar Cottage and Kitsilano neighborhood houses in Vancouver, was coordinator of the Reach Health Center for a couple of years in East Van, and was executive director of the BC Association of Social Workers for about 5 years. So I had a fairly wide range of practice background, frontline stuff. Never did the hard work of child protection, and as I woke up one morning, when I was close to the end of writing my dissertation, and I had this image of the personnel social worker at the Vancouver Children's Aid Society many years ago, and the little half-hour, 45-minute interview I had with her. And at the end of that, we agreed that I wouldn't be pursuing a career in child protection. And I walked away very happy. Those many years later, I woke up and realized, holy shit, she counseled me out of child protection, and it took me 25 odd years to realize that. Instead, I was more in the general field of child welfare, community work, youth work, etc. But the irony of my life was I was surrounded by child protection social workers all my life. In fact, I married one. And my younger brother was a child protection social worker, and good friends are. So it kind of, my aunt and uncle were, and another aunt and uncle were foster parents. So it's sort of like it, nevertheless, in spite of my attempts to resist it, it seeped into my soul. And so when you're dating somebody who's working at emergency services and you're meeting her at all hours of the day and night as she comes off shift, she's telling you all these interesting cases, somehow that led to doing some research work about child protection and a kind of a lifelong interest in child protection. So that's a bit of a longish introduction to me. David, I'm not wearing a watch. I wonder if you could tell me when about, I'd really like to try and zip through this if I don't sidetrack too much and allow some time for questions and discussion. So if you could tell me a 15-minute signal, would that be good? So the topic of today's presentation is promoting engaged fathering in child welfare practice. And the little drawing there, I just have to credit that to my daughter, done with some reluctance when she was a teenager. I'm really representing these 4 other people, plus myself, who came together to begin to study this topic a few years ago. Leslie, Marilyn, and Susan are at the University of Victoria. Lena is at Durham University in the UK. The research was funded by the Social Sciences and Humanities Research Council of Canada. And those of you who love references, in the photocopied article that David put in your packs, if you look for those names, Brown as the first author, or Strega, once in a while you see my name as the first author, but mostly it's Leslie and Susan were first author. You can trace out some of the other publications that come from the stuff we did. So first of all, what's child welfare? In a nutshell, it's a system of legislation and services. In Canada, it's under provincial jurisdiction. It started up in the 1890s. Ontario was the first province in Canada to have child protection legislation. It's organized the way the services are organized in BC, Quebec, and Alberta. It's primarily a public service, i.e. the child welfare function are civil servants under the direction of a provincial minister and a provincial government. Some provinces, Ontario as an example, it's children's aid societies, arm's length from government, spread throughout each community of Ontario. The last 20 years to 30 years, what's been changing has been the growth of Indigenous child welfare organizations across Canada. Several different models: tribal council, band council operation, band bylaw operation, urban Indigenous child welfare organizations in big cities. But that's part of the changing character of how child welfare services are organized. So what does child welfare do? Those are the basic functions on the left, which I'll just won't read them all. But I think one of the things I just want to draw attention to is when we're talking child welfare in Canada, we're really talking about 2 to 4% of the children across Canada have contact sometime over their lifetime with child welfare services. You can say it's a real minority, but it's a really important minority for a whole society to think about. BC, it's about 9,000 to 11,000 children per year. That for some part of the year, and sometimes for many years, and sometimes for their whole lifetime, the BC government is the parent, father and mother, right? Well, the other thing that all the research shows you, overwhelmingly, it's not the rich whose parent becomes the BC government. It's children from poor families. Secondly, it's children from racialized groups. What's interesting is the only group that we count right now are Indigenous children. I've put 40% plus because I'm using on that 40% sort of the approximate official statistic for BC. But as any Indigenous person will tell you, what constitutes an Indigenous person is complex. And there's been loss of identity, and there's many more children in the child welfare system that are Indigenous than are actually counted. Why do we know it's this number? Why is that the official statistic? Because that's the statistic that the BC government uses to bill Ottawa for the care of children who are regarded as status Indian children, and therefore their responsibility under the Constitution and et cetera and so on, that can be, the province can be reimbursed for. So we don't count black children, we don't count South Asian children, we don't count Jewish children. They're there. Unknown numbers at present. So what was our research about? We were interested in looking at how fathers have contact or don't have contact with the child welfare systems that exist. And we did this whole range of things. Right? Interviews with fathers, focus groups with social work practitioners, studies of case files, and a look at to what extent social workers are taught about or educated about fathers as part of their BSW curricula. But first of all, we need to go back a step and say, so what's a father? Well, sure, it's the guy who gives the sperm, all right? But there's also people who marry women who have kids legally. So they become a father. That's how I got father number 2. My mother remarried when I was 14, got a stepfather. So, administrative legal act. But men also live with women in intimate relationships, sometimes for a long period of time, sometimes for a short period of time. Sometimes they function in a parental manner with the kids. Well, we think that's a father. Sometimes they might be the uncle of the children. Sometimes they might be a good friend, etc. and so on. In a nutshell, we simply said, what constitutes a father is this fancy term called contested concept, simply meaning there's a lot of disagreement about who exactly or what exactly is a father. But we wanted to take an inclusive approach, so we said, look, it's the whole range. So then we got into the research, said, you know, what's interesting here is contemporary popular and professional discourse, radio, TV, magazines, advertisements, the last 10, maybe 15 years, books, articles, talk about dads, get involved with your kids. It's great it's good for them, it's good for you. So there's a lot within our culture that's changing, that's promoting involved fatherhood. But child welfare policies and practices, the more we looked at it, seem to promote and encourage uninvolved fatherhood. Why is that? Well, the second paradox, fathers exist in the lives of women and children who are involved with child welfare. They're there, but they're rarely seen. They're rarely contacted. They're rarely included or involved. One of the fathers we interviewed gave us this line and this image. For child welfare, it seemed to us the fathers are ghosts. They're visible, but they're invisible. The social worker walks into the house. The father might be invisible. The social worker leaves. He becomes visible. The mother might refer to him. But sort of this notion of appearing and disappearing. Well, how do we get there? How do we get to that one image and some other findings? We randomly selected a number of child welfare files in a mid-sized Canadian city, not British Columbia, Canada, Nevada City. 116 files, so as you can see, if you do the math quickly, less than 50% of the files had a father noted in the files. Okay? And there were documented child welfare concerns, or child protection concerns. So then next stage in our research, we're analyzing these files. We constructed these categories, and this is all, those of you who are interested, is all written up in the Mother Blame, Father Absence paper. We looked at how social workers wrote about fathers in the files. And some of them were assessing them as risks. Some were being assessed as really potential assets to the kids and the mothers. Some, well, could be both. And a whole bunch were viewed as irrelevant. So as you see this pie diagram, over half, the social worker said, you know, we don't think this guy can play any kind of a useful role to this kid or this mother. So an assessment of irrelevancy. Right? So then we looked at contact. Okay, smaller number here. By contact, we basically talked not about the social worker actually making contact with a father, but whether they initiated contact, sent a piece of correspondence, made a phone call, whether or not they spoke to the person, but whether they took the initiative to try to make contact. Okay? In cases where fathers were identified and where they were considered a risk to the child, less than 50% was there any attempt made at contact of the father. When the father could be a potential asset to the kid, you know, you're getting up about 75% attempts at contact. When the father was viewed as a potential asset to the mother, around 50%. Right? So clearly, social workers are not taking the steps to involve fathers, to engage fathers.